When people hear they need colon or rectal cancer surgery, one of the first questions is, am I going to need a bag? Today, we'll break down the main surgeries, who needs a colostomy or ileostomy, what life after surgery looks like, and the possible complications you should know about it. So first, let's discuss the types of surgery for colon cancer. For colon cancer, the standard operation is a colectomy, removing part of the colon with a tumor. And this is going to be based on location of the tumor and its blood supply. For right-sided colon cancer, we perform a right hemicolectomy. For left side, we perform a left hemicolectomy. For sigmoid, we perform a left lower quadrant sigmoid colectomy. And total colectomy is actually performed when the entire colon usually is affected in such cases as hereditary syndromes or extensive disease. Most colon cancer surgeries allow the surgeon to reconnect the bowel ends, so patients usually do not need permanent bags. For rectal cancer, surgery is a little bit different because the pelvis anatomy and how close the tumor is to the anus plays a significant role. There's going to be three types of surgeries. For high anterior resection, this is going to be the proximal to mid-rectum, which is above the peritoneal reflection. So part of it can be resected. The low anterior resection, in which part of the distal rectum is removed, which is past your peritoneal reflection. So this is now closer to your anus. The colon is reattached, and sometimes a temporary bag is used for healing as a diversion. So the last one is when the tumor actually involves really low distal rectum and partly your anus. Sometimes this cannot be salvaged. And abdominoperineal resection, meaning removing your distal colon, which is your sigmoid, your rectum, and your anus, and you end up with a permanent bag, which is a permanent colostomy. The flap down to your perineum is now closed after, and you end up with a left lower quadrant colostomy afterwards. For smaller lesions, occasionally we can do transanal excision, which is local surgery. For very early cancers, the tumor is removed through the anus without removing the rectum. So whether you need a bag often depends on how low the tumor is and whether the anus can be preserved. A bag could either be a colostomy or an ileostomy and can be temporary or permanent. Temporary, often used for low rectal surgery to let the new connection heal. So this is a diverting loop ileostomy. Usually it is reversed in 2 to 3 months after the connection is shut to ensure that there is no leak or stricture. Permanent is needed if the rectum and anus are removed or if a reconnection is unsafe. If you do an abdominoperineal resection and there's no more anus, then you end up with a permanent bag. Or if the high-risk surgery and you end up with a leak or it is very unfavorable and dangerous, sometimes an colostomy is left in place to avoid those risk of complications. Most cancers do not require a permanent bag. Rectal cancers, low in the pelvis, are ones most likely to need it. So what's the life after surgery? Patients often worry about quality of life after surgery. The truth is, many people with an ostomy bag live full, active lives, work, exercising, and even swimming. It takes adjustment, but modern ostomy appliances are discreet and reliable. Patients without a bag may still experience changes like altered bowel habits, frequencies, and urgencies after rectal surgery, known as low anterior resection syndrome. Like any operation, colon cancer and rectal cancer surgeries carry risk. Common ones include an anastomotic leak, meaning the connection doesn't heal well and then poop starts to come out. An infection, which is an abscess formation, maybe secondary to the leak or from contamination. Bowel obstruction from scar tissue, This could also be from the connection scarring down, causing a stricture. Sexual or urinary dysfunction because your hypogastric nerves play an important role and are in the surrounding areas of dissection. These are risks, but with modern techniques and minimally invasive surgery, complication rates are improving. So the key differences for colon versus rectal surgery, to summarize, is colon cancer surgery usually allows reconnection. Permanent bags are more uncommon. Rectal cancer surgery depends on how low the tumor is. Some patients can keep normal bowel function, but other needs a permanent colostomy. And sometimes you may need a temporary loop ileostomy for diversion of your poop. That's why rectal cancer treatment is often done by specialized colorectal surgeons and sometimes include chemotherapy and radiation before surgery to improve outcomes. For tumors that are large, radiation therapy is actually performed to allow tumor shrinkage that helps with sphincter preservation. The chemotherapy is performed in that aspect to treat systemic disease because of the spread of the rectal cancer is different from the spread of the colon cancer. Surgery for colon and rectal cancer is life-saving, but also life-changing. Whether or not bag is needed depends on the tumor's location, the type of surgery, and individual patients. If you found this breakdown helpful, please click the like and subscribe button. And if you guys have any questions, please type them in the chat. I'd love to answer them, and check out the other videos we have. And I'll see you guys next time.